Here are the top stories for today, October 16, 2021. Beefing up response, the country rolls out the inoculation of minors against COVID-19 as part of efforts towards achieving population protection. Metro Manila is now under moderate risk classification for COVID-19 according to the latest Octa research report as infections steadily go down, prompting the easing of some curbs. The country updates the list of red, green, and yellow countries as well as testing and quarantine protocols for arriving passengers. And the Philippine Statistics Authority says it will soon launch a mobile version of the National ID. It reiterates the ID is valid even without a handwritten signature. Good day, I'm Marita Muahe. Welcome to the PNA Newsroom. The pilot rollout of the vaccination of minors aged 12 to 17 begins today. A ceremonial vaccination was held this morning at the National Children's Hospital. The government has officially launched the vaccination drive for minors aged 12 to 17 years old with comorbidities. Vaccine czar Carlito Galvez Jr. led the ceremonial rollout at the National Children's Hospital along with the Health Secretary Francisco Duque and Senator Sherwin Gatchalian. Galvez said the vaccination of minors is a significant event as the country gradually opens face-to-face classes. Minors availed of the free COVID-19 jobs are accompanied by their parents or guardians as their consent is needed before getting the shot. They also need to present a medical certificate as proof of comorbidity. The pilot inoculation is the first phase of the two-phased event. Priority are given to those who are 15 to 17 years old, while the second phase will inoculate those who are 12 to 14 years old. The rollout is simultaneously held in the other select hospitals such as Pasig City Children's Hospital, where some 60 children with comorbidities received their first dose of COVID-19 vaccines. Other participating hospitals are the Philippine Heart Center, Fidel Mundo Medical Center, Philippine General Hospital, Makati Medical Center, St. Luke's Medical Center in Taguig, and Philippine Children's Medical Center. COVID-19 vaccines continue to pour in the country with the arrival of Pfizer and Sinovac jobs. Last night, more than 800,000 Pfizer doses were delivered to the country. National Task Force Against COVID-19 Chief Implementer and Vaccine Czar Carlito Galvez Jr. said the fresh shipment is part of the 2.29 million pesos government-procured Pfizer doses that will be delivered to the country until tomorrow. Meanwhile, China has donated 1 million more doses of the Sinovac vaccine, which are expected to arrive next week. The latest aid is expected to help the Philippines in its vaccination rollout, especially now that it targets to complete the immunization of 80 to 90% of the population by the first quarter of 2022. Galvez said that with the steady supply of COVID-19 vaccines, the country would reach the 100 million mark by the end of October and increase to 160 million doses by year-end. Metro Manila is now under the moderate risk category. These as all the other 16 cities and other towns in the National Capital Region registered a downtrend in reported COVID-19 cases. Based on the latest study of the Octa Research Group, the reproduction number in the NCR has decreased to 0.60 as the 7-day average in new cases dropped to 1,847. This is 30% lower than the previous week's average. Octa says the positivity rate in the NCR is at 11%, while the healthcare utilization rate is at 49%. As more and more localities report a decreasing number of COVID-19 infections, the IATF decided to ease restrictions in Metro Manila, placing the region under alert level 3 starting tomorrow until October 31. It says the relaxation of alert levels in Metro Manila will pave the way for the reopening of more businesses. The World Health Organization says that while it is supportive of the gradual easing of restrictions in Metro Manila, measures must be in place to prevent local transmission. In a press briefing, WHO Representative Rabindra Abesaying explained that while the National Capital Region reports an average of 2,000 cases per day, it is important for the government to bring back as much as economic activity as possible while not putting people's lives at risk.
It's not about relaxing or reducing the restrictions. It's about calibrating so that we continue to take risk-based measures. We continue to urge the population to do everything, the physical distancing, the hand hygiene, the mask wearing, even though they are fully vaccinated, because these are critically important to maintain the gains and further strengthen the transmission reduction.
Abesaying also stressed the need for COVID-19 booster shots but clarifies it is intended for people with immunocompromised conditions who have been unable to develop full immunity. He said that WHO recommends the booster shots among the elderly population of the A2 who have received 2 doses of Sinovac or Sinopharm.
Clarify, Dr. Rabi, no? So the recommendation is all individuals who were vaccinated with Sinovac or Sinopharm be given 3rd dose, or is it limited only to the medical frontliners, those with comorbidities, and the seniors?
Only the seniors at this point of time. Of course, those with comorbidities who we recognize as people who are immunocompromised, even if they are less than 60 years, we will advocate for the 3rd dose.
Okay. But the general population, they do not need a 3rd dose yet.
We don't have a recommendation for general population.
Abesaying also said that the WHO strongly supports the ongoing pediatric vaccination drive of the government.
WHO strongly supports this. This is a sage recommendation. Adolescents between 12 to 17 years who have comorbidities, we are encouraging them to be included in the primary group of vaccination for vulnerable populations. So we support this.
Bulacan Governor Daniel Fernandez is appealing for a lower quarantine classification, while Iloilo will still maintain the implementation of health protocols amid the shift to a lower status. The details are from Chris Mundo.
Bulacan Governor Daniel Fernando is appealing to the IATF to consider the province under the less restrictive general community quarantine. The new quarantine classification released by the IATF still places Bulacan under the MECQ status until the end of the month. Fernando said many of his province mates are begging for the opening of their businesses that have been severely affected by the MECQ restrictions. He mentioned that the recovery rate of Bulacan is now at 97% and the number of the daily average cases also dropped from at least 360 from August to September to 133 this October. The governor said he is confident that the lowest reported case last December 2020, which was more than 500 cases, will be surpassed and Bulacan will be on a flat line until December. In Iloilo Province, local officials remind the public to continue to observe the minimum public health standards amid the downgrade from MECQ to GCQ. Under the GCQ, more establishments in the province will be able to operate from 50 up to 100%. There will also be an improvement in the level of social gatherings that will be allowed. And in Eastern Visayas, health authorities noted a decline in the number of new COVID-19 cases. The lowest positivity rate this week was on October 13 at 11% and the highest was on October 10 at 16%. This week's figure is lower than the 21% positivity rate noted on October 5. Despite the drop of new cases, the health department continues to appeal to the public to keep following and keep practicing the minimum public health standards all the time and in all settings. For the PNA Newsroom, I'm Chris Mundo.
The Department of the Interior and Local Government is set to submit the short list of candidates for the next PNP chief before the end of the month. This as PNP Chief General Guillermo Eleazar will bow out of the service on November 13 upon reaching the mandatory retirement age of 56. Eleazar is a member of the Philippine Military Academy Hinirang class of 1987 before being named as the country's 26th top cop. He held all three top posts of the police force: Deputy Chief for Administration, Deputy Chief for Operations, and Chief of the Directorial Staff. He also served as Director of the National Capital Regional Office. Eleazar assumed as PNP Chief on May 7, replacing General Debold Sinas. DILG Secretary Eduardo Año said this basis for the next PNP Chief are seniority, merit, and service reputation. Still to come, the country updates its list of red, green, and yellow list of countries. We tell you the revised quarantine and testing rules for arriving passengers. And the Labor Department looks at soft loans for employers to help them comply with the 13th month pay law. Details ahead, this is the PNA Newsroom.
Ito ang Fast 5. Mayroon tayong 5 minuto para tanungin ang mga eksperto tungkol sa COVID-19.
Hi everyone, I'm Dr. Ana Ong Lim and I'm with the DOH Technical Advisory Group.
Anong mga sintomas ng COVID-19 ang pwede i-treat sa bahay?
So napakagandang tanong. Ang mga mild symptoms, pinakakaraniwan pa rin siya sa mga nararamdaman ng mga taong nagpa-positive sa COVID-19. Kasama na dito yung lagnat, ubo, sipon, pananakit ng katawan, yung iba nagtatae. Pinaka-importante talaga is bantayan yung hirap sa paghinga kasi once sumumpong na yon, hindi na natin pwedeng sabihin mild and definitely kailangan na siguro na makita sa ospital o makita ng kanilang doktor.
Paano natin malalaman kung pwede tayo mag-home isolation?
Magandang mapag-usapan ng home isolation kasi lalo na ngayon, maraming mga taong nasa mga TTMFs or quarantine facilities or even sa hospital. And for as long as yung ating pamamahay ay may sariling lugar or isang silid na kung saan pwedeng mamalagi yung may sakit, and mas maganda rin sana na may sarili siyang magagamit na banyo.
Ano naman ang pwede kong gawin kung meron akong lagnat?
Ang lagnat ng COVID is not any different kumpara dun sa lagnat na nadala ng ibang sakit. Kino-consider natin na may lagnat ng isang tao pagka ang kanyang temperatura ay 37.5 pataas. Now, typically, kung meron tayong lagnat, iniinuman lang naman natin to ng paracetamol. Karaniwan, isang tableta tuwing ika-4 hanggang ika-6 na oras.
Ano naman ang home treatment para sa sore throat?
Ang sore throat, karaniwan, ginagamot lang natin yan using supportive care. So tulad na lang ng saline gargles or pagmumog ng water na may konting asin, o kaya pwede ring gumamit ng mga menthol preparations or menthol candies para lang medyo maibsan yung pananakit ng lalamunan.
Ano naman ang warning signs ng paglala ng mga sintomas?
Ang pinaka-importanting bantayan sa mga simptomas na lumalala na related to COVID-19 is really yung hirap sa paghinga. Pwede rin yun na rin na magdala nung confusion, pwede rin yung mga simptomas tulad ng sobrang panghihina kasi halos hindi na makakain, hindi makainom, no? So yung mga ganong klaseng signs, kailangan siyang masubaybayan ng healthcare professional.
Paano ko naman maiiwasang mahawaan ang mga kasama ko sa bahay?
Pinaka-importante dun sa iisipin natin pag tayo nag-isolate is dapat talaga nakabukod tayo sa ibang tao. So, dun lang tayo sa ating silid, dun na tayo kakain, hindi na tayo lalabas hanggang makatapos ng 10 araw. Now, kung tayo naman ay nasa isang lugar na shared bathroom pa rin ang ating ginagamit, sana yung surfaces ng banyo tulad nung yung doorknobs, yung faucet, yung pinaka-surface ng lababo, at saka yung pinag-upuan natin sa inidoro, pupunasan muna natin yan bago natin iwanan ng banyo para yung susunod na gagamit, hindi naman mahawaan ng ating mga secretions o yung mga tilamsik ng ating laway kung sakasakali naman ay tayo ang gumamit ng banyo.
Sino po ang pwedeng kausapin kung may karagdagang mga tanong pa ako?
maraming resources sa ating mga communities at napakaraming health workers na handang tumulong. No? So unang-una na siguro doon yung ating mga BHERTs, no? Sila naman ay naabisuhan, o yung mga midwives or nurses sa ating community, even our local health center physicians, they're always ready to help us with our questions.
Maraming salamat, Doc Ana. May mga paalala pa po ba kayo?
Karamihan pa rin naman sa mga kababayan natin nagpa-positive for COVID ay nabibilang dun sa mild and asymptomatic category. So, mukha namang kaya, no? Most of the time, nababantayan itong ating mga kapamilya within the home. Ang importante lang, siguro, habang maaga, meron ng link to telemedicine o kaya nakausap natin yung ating mga barangay or community healthcare workers para kung sakasakalit medyo lumala yung lagay ng ating kapamilya ay nakaset up na kung anong susunod nating gagawin. Maraming salamat sa inyong lahat and mag-ingat po tayo.
Bida Solusyon Plus laban sa COVID-19.
The Philippines has revised the roster of red, yellow, and green countries and jurisdictions. The testing and quarantine protocols for arriving passengers are also updated. Under the updated guidelines, all fully vaccinated foreigners from green list countries no longer need to undergo a facility-based quarantine. However, they must present negative RT-PCR test results taken within 72 hours before departure from the country of origin. Fully vaccinated overseas Filipino workers or non-OFWs from green states will not undergo quarantine if they present a negative RT-PCR test taken within 72 hours prior to departure from the country of origin. They also have the option to stay in a quarantine facility and take the RT-PCR test there. They are also advised to self-monitor for any symptoms until their 14th day in the country. In the case of unvaccinated or partially vaccinated minors, they are mandated to observe the quarantine protocols corresponding to the vaccination status of their parents or guardians. Meantime, arriving passengers from red countries will be barred from entering the country. These also include those who have stayed there for 14 days prior to their arrival to the Philippines, regardless of vaccination status. But for returning Filipinos, they will be required to spend their first 10 days in a quarantine facility and the last 4 days at home. They are also mandated to take the RT-PCR test on their 7th day in the country. On the other hand, fully vaccinated passengers from yellow countries will need to undergo facility-based quarantine until the release of their negative RT-PCR test results taken on their 5th day in the country, after which they shall be required to undergo home quarantine until their 10th day. The Department of Labor and Employment suggests offering soft loans for employers affected by the COVID-19 pandemic to help them pay for their employees' 13th month pay. Labor Secretary Silvestre Bello III said the soft loans will help employers fulfill their obligation to pay the 13 months of their employees on or before December 24 this year. Bello said he recognizes the plight of the employers, especially those in the micro, small, and medium-sized enterprises who are reeling from the effects of the restrictions brought by the health crisis. He said he already discussed it with Employers Confederation of the Philippines President Sergio Ortiz Luis Jr. and Trade Secretary Ramon Lopez. Finance Secretary Carlos Dominguez III will also be informed on the matter to coordinate with the creation of loan facilities. The House of Representatives has allocated 20 billion pesos for the procurement of COVID-19 vaccines and booster shots from the proposed 5.024 trillion peso budget for 2022. Lawmakers also want to set aside 4.5 billion pesos for the special risk allowance of public and private healthcare workers. The chamber also earmarked 5 billion pesos for the medical assistance to indigent patients of the Department of Health. House Appropriations Committee Chair Eric Yap said these amendments introduced to House Bill 10153 or the proposed 2022 national budget would be crucial for the country's recovery from the pandemic. Other amendments include funding for the Tulong Pangkabuhayan sa Ating Disadvantaged or Displaced Workers Program, Sustainable Livelihood Program, and Service Contracting Program for PUB drivers, among others. Meanwhile, the chair of the House Ways and Means Committee said the country's 5% gross domestic product growth target for this year is still attainable as more COVID-19 vaccines are delivered. Albay Representative Joey Salceda said vaccine equity is necessary to fix inter-regional supply issues in lagging regions like the Bangsamoro Autonomous Region in Masle, Mindanao, and Bicol. He said problems in supply and demand would still exist no matter how high the vaccination rate is in Metro Manila if the provinces are still affected by COVID-19. Meantime, Salceda said it is still possible to stay at 4% or below depending on whether the country experiences a super typhoon in October and November and whether fuel costs in the world market continue to increase. Presidential Communications Operations Office Secretary Martin Andanar has called for public support for the government's efforts towards recovery from the impacts of the COVID-19 pandemic, regardless of political affinity. Andanar asked everyone to help President Rodrigo Duterte in fulfilling the government's recovery roadmap until the end of his term. He said that political color should not be an issue in continuing the administration's programs and projects because public welfare is at stake. Andanar said that the rollout of the Duterte Legacy Communications campaign is an upgrade on how the government reports to the people. He noted that reporting the accomplishments of the administration no longer only relies on the annual State of the Nation address. Ongoing initiatives tackle how the campaign promises of the president are being carried out to the grassroots level. Andanar hopes that this strategy will be adopted by future administrations so that they can also cement the government's efforts in developing the country. The Philippine Statistics Authority is working on the development of a mobile version of the Philippine Identification or the National ID. PSA Undersecretary Rosalinda Bautista said the Philippines team is targeting to launch the mobile Phil ID early next year. Any PhilSys registrant may avail of the mobile Phil ID by linking the generated 12-digit PhilSys number to the mobile ID version. Bautista said the Phil ID remains non-transferable even if its mobile version becomes available. The PSA assured that layers of security will also be included in the development of the mobile Phil ID. Meanwhile, the PSA calls on government, line agencies, and financial institutions to recognize a Phil ID card as sufficient proof of identity of their clients. The PSA reacted to claims that some banking institutions do not recognize Phil IDs in financial transactions. Bautista said the digitally working Phil ID is embedded with powerful authentication features, even without the registrant's handwritten signature on the physical card. She said identity verification can be done both offline and online using the Phil ID card. The PSA is now conducting webinars on the features of the PhilSys. Moving on to business, the Bangko Sentral ng Pilipinas wants more cash agents deployed even in villages in far-flung areas across the country to boost the government's bid for financial inclusion and increase in electronic financial transactions. BSP Financial Inclusion Office Director Ellen Joyce Suficienza said the regulator aims to expand the penetration of these providers at the barangay level. She said cash agents provide closer access to channels for digital transactions, making cash in and cash out as well as online payments more convenient. Cash agents are retail outlets that provide basic banking services like cash deposits and withdrawals, balance inquiry, fund transfer, and bills payment. BSP Governor Benjamin Jokno said the number of cash agents rose by 242% in 2020 to more than 58,000 from around 17,000 in the previous years. Banks with cash agent operations increased to 15 in 2020 from 11 in the previous years. Up next, beneficiaries of the Balik Probinsya Bagong Pag-asa program are hopeful for a bright future in Apayao. And heading north, Ilocos Norte has revised its rules for travelers. Back after a quick break, stay with the PNA Newsroom.
The COVID-19 pandemic has greatly changed our lives for the worse. Lives and jobs were lost and economies reached a meltdown. Thanks to the arrival of safe and effective vaccines, we are one step closer to normalcy. It's time to do our part, get vaccinated for our safety and for our recovery.
You are there in that community, go there and have yourself vaccinated by any of the vaccines available. They are all potent, they are all effective.
I would like to appeal to all our kababayans, please get vaccinated against COVID-19 and be the government partner in preventing further spread of the disease. I encourage you to get vaccinated as soon as possible time. These vaccines are safe and they are the key to reopening our society. The need for international solidarity and cooperation cannot be made clearer than this pandemic because everyone is safe. No one is safe globally until everybody is safe.
Vaccines work.
A family of 6, the latest beneficiaries of the national government's Balik Probinsya Bagong Pag-asa program, expressed optimism for a brighter future amid the pandemic after arriving in Apayao on October 13. The Dagyao family was scheduled to leave on October 11, but their trip was delayed due to the effects of severe tropical storm Maring early this week. The family was brought to a quarantine facility where they will spend 14 days before going home to their home in the town of Flora. Aquino Daguio, the family patriarch and a UV Express driver in Metro Manila, thanked the government for helping his family return home. The BP2 program was created to address the congestion in Metro Manila's urban areas. Government agencies provide beneficiaries with support and incentives on transportation, livelihood, and other family needs. The BP2 program has sent families back to Leyte, Isabela, Davao del Norte, and Bicol. Some 8 members of the Manobo-Dulangan community in Sultan Kudarat who have been tricked into joining the Communist New People's Army surrendered to the military on Thursday. These surrenders also turned in 13 firearms and 3 explosives during the surrender rites in Barangay Masiyag, Bagumbayan, Sultan Kudarat. Ali Danyan alias Kadandan, the leader of the group, said they belonged to the NPA East Daguma Front South Regional Command, Fire South Mindanao region. He said they were recruited to join the NPA with the promise that the organization will provide support to their families. The former combatants received assistance from Bagumbayan Mayor Jonalet De Pedro, who also endorsed them for inclusion to the Enhanced Comprehensive Local Integration Program, or ECLIP. In Bukidnon, the provincial government and the 4th Infantry Division officially welcomed to the fold of the law 30 former rebels from the Communist Party of the Philippines New People's Army National Democratic Front. They were reunited with their families during the 403rd Infantry Brigade's press conference at Camp Osito de Bahian on October 12. Governor Jose Maria Zubiri Jr. pledged to build 200 houses for the former rebels and vowed to provide better opportunities for them. Since 2016, a total of 1,419 former rebels have already received assistance under the ECLIT. Nearly 100 farmers in Central Visayas are now owners of the piece of land they are tilling after they received their Certificates of Land Ownership Award from the Department of Agrarian Reform. The Region 7 distributed CLOAs to farmer beneficiaries in Barangay Vito in the town of Minglanilla, Cebu on Thursday. Last October 7 and 8, Regional Director Res Ucias led the distribution of CLOAs to farmers in Barangay Valle Hermoso in Carmen Town and Barangay Ilihan in Ubay Town, both in Bohol. The recipients thanked the Duterte administration for fulfilling their promise to distribute agrarian lands to the poor farmers. Ucias meanwhile encouraged CARP beneficiaries to organize an Agrarian Reform Beneficiaries Organization to enable them to advance their capabilities. He also urged them to distribute their farm produce through the Linking Smallholder Farmers to Market and Microfinance program of DAR. The Ilocos Norte Provincial Government on Thursday updated its travel guidelines for returning residents who are compliant with COVID-19 testing requirements. In an advisory, it said returning recipients must present a proof of acceptance from the destination. A negative COVID-19 swab test result must still be shown at checkpoints regardless of vaccination status. Based on local guidelines, a negative antigen test result is required for those coming from areas under General Community Quarantine or Modified GCQ areas, and those under Alert Levels 1, 2, and 3. Non-residents from Alert Level 4 areas must present a negative RT-PCR test results taken within 72 hours before their travel. Let's take another look at today's biggest stories. Beefing up response, the country rolls out the inoculation of minors against COVID-19 as part of efforts towards achieving population protection. Metro Manila is now under moderate risk classification for COVID-19 according to the latest Octa research report as infections steadily go down, prompting the easing of some curbs. The country updates the list of red, green, and yellow countries as well as testing and quarantine protocols for arriving passengers. And the Philippine Statistics Authority says it will soon launch a mobile version of the National ID. It reiterates the ID is valid even without a handwritten signature. As Filipinos, we all have a vital role to play in preventing the spread of COVID-19. So remember, wear face masks and face shields. Wash your hands often. Practice safe physical distancing. Go out only for essential reasons. And get vaccinated as soon as possible to protect ourselves, our families, and the community. Together, we can beat COVID-19. Thank you for watching another episode of the PNA Newsroom. For more news content, check our webpage or log on to the Philippine News Agency's Facebook and Twitter accounts. For more stories about the government and how it serves Filipinos, look for these hashtags in all of our social media platforms and websites. We are shown on the pages of the PCOO and its attached agencies. Also watch us on television on PTV4 and IBC 13. It's 71 days before Christmas. However, we have to be reminded that we have to follow the imposed health and safety protocols at all times. And that's your daily dose of the biggest stories that you need to know from the PNA Newsroom. We tell stories that inspire change. I'm Marita Muaje. Have a good day.